Okay, it's recording. So my first question, could you tell me a little bit more about your career background and what you're doing now?
So right now um, I'm in the school system, public schools. I assigned to one school, which is pre-K3, meaning we have 3-year-olds all the way through 8th grade. However, we do not have 6th and 7th grade. And so I serve as the professional counselor there, and the school behavioral health coordinator, meaning that I have a team of 2 social workers, another professional counselor, a behavioral analyst, and 2 behavioral technicians. And we are mandated with the social emotional learning, supporting that, modeling that, um, determining intervention students, what students need, as well as whatever deliverables are for our own caseloads and requirements for whatever we're doing. So social workers may have their own clients, case list. One is assigned to special education students. So I coordinate that group of people, and look at holistically look at to see what the mental health needs are, and the social emotional needs are for the community of about 580 students.
And what's the demographic like at your school?
So we are multicultural as far as nationalities, majority being from, of course, the DC area. I would say we have majority African American. We are almost our community has grown. We have a large immigrant community from Central America, Honduras, Nicaragua, and Dominican Republic. We have, especially in our lower grades, we have a pretty large, I would say a third of our ECE, which is early childhood, which is K3 through kinder. About a third are from East Africa, Ethiopia, and Eritrea. We have I would say we may be at 10% European Caucasian, and we really don't have, we may have students right now from either Southeast Asia or, yeah, that's about it. So we have a large, demographic, but we are Title I school, which means that we are considered to be servicing our most vulnerable in the district for socioeconomic resources. And we also, in that demographic, we also have, I would say we have about 15 documented families that are classified as homeless by the District of Columbia. But because of the pandemic, we probably have a lot more, not necessarily in shelters, but either couch surfing, meaning that they are living with relatives and friends, or they're in multi-family dwellings, not planned, but because they're having a hard time. So we have families that live in Tacoma Park because we're right at the border. We're Piney Branch and Dahlia. We're right at the corner of Tacoma, Maryland. So we have families that own homes, may have, steady incomes, federal government working families or private enterprise. And then we have families where we have, newly immigrated to the United States who are looking for work or working under the table or working shift jobs or in the process of being documented. And so we have a very wide range of just like America. That's what our school is. And Yeah, so how that manifests in delivering resources, we have to be, we just have to be equitable and understand that, when you're dealing with families that are new in country or homeless or, transient, or even whose family adults have lost jobs, one or two in the home right now. You have to think about their basic needs, what their requirements are first, and then go into like interventions from it. The basic needs are not being met, uh, then it's really difficult to even begin to have a conversation about mental health.
Gotcha.
Yeah.
That's something that I've found with other counselors I've spoken to through this process. But I was just wondering, as far as counseling does go, what are the most prevalent mental health concerns you see among your students?
I would say that it's funny you say this because I did an assessment. We're doing an assessment with my new clinician. The ones that I would say are, whether they are diagnosed or not, most prevalent are ADHD, and that's not necessarily ADHD. There's some controversy about ADHD because it is one of those diagnoses that I believe are overdiagnosed. And it's very easy to get that diagnosis. Even I believe a pediatrician can diagnose ADHD as opposed to a mental health clinician. And so quite a bit of ADHD. However, for the ones that actually have been diagnosed by a mental health clinician, a lot of the ones that I'm seeing lately have a defiance component to it. So ADHD. Another one is depression, obviously, with what's going on, depression. So general anxiety disorder, depression. I won't say there's a lot, but there is always an underlying, especially with middle school, suicidal ideation and self-harm and addiction, as well as trauma, early childhood trauma. Some diagnoses of PTSD, they try not to put PTSD as a diagnosis for younger children, but they are based on history and what the kids have been exposed to. And we recognize that, and that is why we're moving towards, really trying really hard to become a trauma-informed school, to have trauma building, because of, I'm not sure if you've heard of ACEs, adverse, ACEs. CIS is adverse childhood experiences. It is a way of assessing and determining the interventions you want in place once you do the screening. For example, if you have a child who just came in from Honduras, right? So they came across and they left the country probably abruptly, or it wasn't determined they wanted to leave, it was the parent. And so you have a child who is uprooted, comes across the border, is probably experiencing some trauma, sense of grief and loss. The experience in the actual journey across the border can be quite horrific. They're exposed to a lot of things that, including obviously in the last 4 years separation from their families. We see a lot of our kids have spent between 1 week to 3 or a month away from their families during that journey. So that's a traumatic experience. And then aside from whatever, a lot of the kids coming from Honduras or I believe it's Nicaragua, where the MS-13 is extremely prevalent. They will have lost either when they are here, we hear that they've lost a sibling or a parent there or an uncle or relative to the gangs. So all these things compound, right? So when they come, for example, in front of me, I will do an ACEs screening. So the first thing that we can check is that they have left their home. There's a sense of loss there, whether you leave in a very wonderful way, migrate to another country, you still, in a plane and it's all nice, you still have a sense of loss. So that's one. Probably the traumas that I experienced beforehand if they're exposed. Um, the fact that maybe they were exposed to robbery or whatever violence across is another check. The fact that they may be in a family at the border is another ACEs. The fact that in a country where the parent, that now maybe they've left a situation, maybe the mom was working in the other country or the dad, or maybe they have a parent, a family member, or they have left a parent there, but that's another check. So then they come here and maybe now they're homeless or they're transient. That's another. All those ACEs, they have determined, this is research based, can affect the quality of life, mental health, and health of this child. It can help kind of, it helps us determine interventions to put in place, because if we don't address some of those issues now, these kids will end up with not only mental health concerns, but they could end up with high blood pressure, heart disease. There are things that affect them because of the way that trauma manifests physiologically. So, having said all that, we do screen for ACEs. We could do better with that, and we also acknowledge that some of the diagnoses that we see are really rooted in trauma. Mm-hmm. So we who may not necessarily have come across the border, but experience living in northeast or southeast in a neighborhood where they hear gunshots, where they have lost family members to homicide, where they may have at least one person that they know very closely who's incarcerated, where they may have gone through the foster system, may or may not. All these things are traumatic experiences, mm-hmm. and they affects their ability to access their learning. So yeah.
Yeah, and in my research, I found that early childhood trauma is one of the biggest precursors for youth incarceration. So I was wondering, mm-hmm. do you deal with incarcerated youth, or have you had students who've been through the system?
Yeah. Yes, I have. I have when I was in the high school setting, when I was at Roosevelt. I had students who were incarcerated for minor offenses and those who had been incarcerated for very serious offenses, very, very serious. I have had students who are being tracked by the system who have the bracelets on their ankles for, incarcerated youth. So yes, and I've also have students who are gang affiliated in the district who have ended up being moved out of the district for their safety to be incarcerated, for example, in Ohio or in Indiana for their own safety, because there are sections of DC that have MS-13, dominated by MS-13, and then they have the 18th Street Crew, which is a carry of what was happening in their home country. And so when they come here, they went in a gang. Because of the family history or family connection to it, sometimes for their own, this is their rationale, and this is what they tell me, for their own sense of belonging or their own security, they end up being involved in the gang that there's history. Mm-hmm. They're not interested in being in a gang, but because other gang members know, they came from such a low and their uncle was in the gang, then they automatically associate them with MS-13, so they're kind of pushed in there. Some of those kids go in and out of the system. They're not in crime, but they get into petty crime, fights. They're kind of in the peripheral of really serious crimes that happen. So going for questioning. So I did like students like that when I was at one of the high schools in DC. Yeah. So it was sometimes when the what do they call them? Probation officers. They would come weekly to check and see if they're attending school, what the behavior is like. That was part of my job, was meeting with them. And then sometimes we have the kids in they're still kids. I would, in my office or whatever, to talk to the probation officer. So the court system would be involved. I'm involved with them. Sometimes MPD would come looking for kids. They can question our team based on some things that were happening. So yeah. Mm-hmm.
Because what I was going to ask, what specific interventions you guys have for them, but that sounds like part of it. Do you think these kids are responsive to those interventions? How successful are they, especially the mental health side of it?
So, you know, I'm thinking about one specific kid, right, who had a diagnosis of a pretty serious diagnosis of oppositional disorder. And he had, you know, he started off, and he was getting to the age where, you know, it could, he was involved in some crimes, stealing, he was gang, you know, he was becoming gang affiliated. And sometimes those crimes, especially when it comes to initiation, can be kind of sex crimes that they do. He was kind of going back and forth, and I know that he was getting behavioral supports. He was getting therapy from the social worker because he was actually on an IEP. He was receiving special education. Because he was, you know, absconding from school, absconding from home. He was interrupting his learning. So I remember he was retained one time. But I know the social worker and him were working. They had you know, they were engaged. They had he trusted the social worker. I'm thinking specifically of this one student. And when she wasn't in the building, to see why he came to school, because there were some days he wouldn't come to school. Because, you know, when you start doing those kind of things, the street life is calling you, and the school is kind of like secondary, right? Like, why am I coming? I found if there had been a stabbing or a shooting, or one of them had been, you know, unfortunately killed, a lot of kids would come into that building. We'd see an influx of kids because, you know, they feel secure in the building. And then after a few days, so I say that all to say he continued with therapy. But I think that he would have benefited, and there was a detective from the Metropolitan Police Department who was also Latino, who was talking to him, trying to mentor him. I think their intervention needs to be very intensive, and I don't see anything that is similar to what a kid who is not gang affiliated, or you know, on the peripheral being gang affiliated, or even having family members who are gang. I feel like those kind of kids, we need to treat them differently and earlier, because by the time you get to 9th grade, it's almost too late, because at 9th grade, they're out in the street already. And because the families are working so many different shifts and not there to, you know, to hold them down and to be there all the time. So they're out there doing whatever. And usually the families don't know this is going on unless the school tells them or they get a call from the police. Yeah. I think that's across the board. That's not even for gang affiliated. I think that's just across the board. Some of these urban schools, they really need to have some programs that are very, very purposeful in targeting kids who even have the possibility of going down that road, not just when it happens, but proactively. Yeah. Enough to have a clinician and going to therapy. We'll be there, we'll do the assessments, we'll send you to hospital if you have a psychotic episode and all that. But, you know, there's other things that are affecting your life that are even sometimes more important than your diagnosis.
Gotcha. So you're working in that was a high school, right? And now you're working in a 6th or elementary and middle school setting now?
Yeah, so I have elementary and 1 grade of middle school.
Gotcha.
Yeah.
So
Yeah.
do you think enough is being done at that level to do early intervention that could prevent some of those high school issues? Or if not, what do you think could be done that'd be different?
At the middle school?
I'd like the elementary to middle school level.
I think a lot of attention is being paid to early childhood, which is great. Okay. Because that's where it all starts, right? I think that it's our kids developmentally, we learn of these developmental stages, Erickson's developmental stages, and they're very clear cut. But in my opinion, it's almost as if 5 years ago, middle school, the kids who are middle school age developmentally have kind of shifted to the 5th grade now. So some of the concerns we were seeing in middle school and 4th grade and the 5th grade. And so I think that they need to continue the interventions and supports as heavily as they do childhood through kinder and through 1st, 2nd, 3rd, 4th, and 5th grade. I think that needs to be more purposeful because I feel that based on what I've seen, I think that they're very big on the trauma training for the early grades and all those things. And then something happens grade, kinder, 1st, 2nd grade. But where we see a lot of the problems cropping up and a lot of the mental health issues ones are in the 3rd, beginning, end of 2nd, 3rd grade is where we begin to see a lot of, kids with some concerns. And also when we're dealing with kids who have gone through the foster system, even one time, that's a good there. Because when they're faced with foster parents, a kid already has a history of trauma and has some possibly behavioral issues. Foster parents can say, I can't handle this, right? And so we can give foster care to foster care, which comes the feeling of loss and grief and trauma. And so I have kids that are in the 3rd and 2nd grade who have, if I can use 2 examples, one has been in the last year through 4 foster homes and the other one has been through 6. And so you can imagine that, what that does to that child, and they can see their parents because, the parents, they were removed from the home. In answer to your question, I think that more can be done at the elementary level. A lot more
So I guess my last question, systemically, there is an issue. There's not enough mental health services for lower income communities. Do you think that reform starts in the school? Do you think it starts in the social work system? Do you think it starts just at a community level in the prison system? Where do you think it needs to begin?
So I'd like to say that it doesn't start in the school because the school can think, but realistically, the school is the one place where everybody meets from every socioeconomic, right? So realistically and thankfully, because school is required in the United States, it makes sense that most of the resources are placed in the school setting. Because we can capture the kids, that's where we would not capture them literally, but that's where kids where they consistently will and hopefully will come, and where we'll be able to have engagements which are very important. Consent, like you can't treat the kids without parent consent, right? Is in the schools. Community, there's a lot of things that can be done in the community. Where you have which are more community health based, right? When we're talking about community health, public health, those kind of things, yes. But if you really want to start with raising kids who have empathy and compassion, and kids who are self-aware, and kids who can advocate for themselves, well, these are things that tie into mental health, right? And kids who can have the advocacy say, should not touch my body is my own space, and have positive regard for themselves and for others, understand why it is, taking drugs, certain drugs is not good for my body and can change the way I think and the things that I do, why I become pregnant, and how you prevent pregnancies, especially when you're not ready to be a parent. All those things can be taught and should be taught in school, and tie into mental health, right? Because if we don't teach our kids about empathy and compassion and self-regulation, which is a huge piece. How to regulate your emotions and anger. Then we have kids who are out there just reacting, and angry kids.
Mhm.
And a lot of them have actually with what's happening with racism and inequity. We now have the added pressure and responsibility of working with their kids on how to channel that creatively and how to minimize the effect of those negative emotions on their health and the decisions they make, right?
Mhm.
And so for some of our kids who have very strong, diagnoses, we have to work more closely with them to give them the opportunity to learn how to decompress and how to channel those frustrations and angers so that they don't do harm to themselves, or they don't sabotage all the things that they have worked towards. And it's been very significant, on the kids, that the whole talks of racism and a lot of things that have been happening in the last 4 years has made our work very, very difficult. Very, yeah.
Okay, well, that's all the questions I prepared. That was really
Okay.
Thank you. That gave me a really great
You're welcome.
perspective. Yeah, that was wonderful.
Thank
So,
you.
thank you for making the time. I appreciate it.
Okay. Take care.
You too.
Bye bye.
Bye-bye.